Would you recommend someone without any ailments, any pain or anything to go into a chiropractor?
Absolutely.
Yeah.
Yeah. So for me, my favorite practice would be all wellness.
Mm-hmm.
You know,
I agree. I agree.
and that means that, you know, I'm just part of the puzzle that they're using for health. And, you know, they're trying to maximize their body's health. And that is by far the best part of care. It's basically when you feel well and you go to the gym, you're probably going to have a pretty good workout.
Mm-hmm.
If you're sore and stiff and all that kind of stuff, you might get a good workout. But when you feel well, you're going to perform better. And so when you come to an office like mine and you're feeling pretty well, I'm just going to be able to accentuate your body's status, you know, by stimulating, you know, movement where it needs it, even though you're not feeling a whole lot of pain. You're not feeling a whole lot of dysfunction necessarily. So for me, yeah, that's the best part of chiropractic is wellness. And then, you know, to not minimize how important it is for pain relief and pain management and things of that nature. But yeah, I would love to be able to always transition people from, you know, some type of a pain management into a wellness kind of reality.
I completely agree. And I think that is by definition, preventive medicine, right? When you could get ahead of it. Unfortunately, most of healthcare is really disease management or waiting for progression to become a true chronic issue. And then you go in and try to address it. Whereas if you came in while you were still well and you were still, you know, you could prolong, that's longevity, that's prevention, that's optimization. And that is saving you a lot of time, pain, and effort to try and come from a chronic disease spot back to health. Listen, the body, as you know, is an amazing self-healing organism, but it only has so much resources before it starts to go symptomatic and then chronic, chronically ill and into a regressive state.
Right. Exactly. It's one of the hardest parts to teach, you know, because like I was saying a moment ago, you know, even if you're going to have some type of surgery, hip replacement, knee replacement, that kind of thing. There's patients that come in and that I've worked with and they know, hey, I want to get my body as good as I can before the surgery and then be able to, you know, return after the surgery. Having that mentality of, hey, having my body in good condition is going to help me get through anything that may come my way. Mm-hmm. You know, it's the same thing with trying to fight some of these viruses, you know. Hey, you want to build up your immune system, you know, and you might get a bug, but give yourself a chance to fight the bug better. You know, it's the same basic concept.
Have you seen that during the pandemic, a switch for people to come in and seek your services or seek a kind of more preventive care?
Well, I've seen more people really interested in some of the information that I have available for those kinds of things. I'm a bit of try to be an educating doctor. So in my treatment rooms, I've got articles of, you know, the most recent information. It used to be mostly chiropractic and mostly, you know, neuromusculoskeletal kind of stuff, but I've added in quite a bit of the virus information. And people do want to, you know, find ways to, you know, stimulate their immune system, and what are the best ways to, you know, if I do get this, what are you recommending? You know, what are the protocols that you think will be helpful? So it's been good. There's been a lot of people that are really trying to tune into natural methods.
Yeah, I've noticed that as well. I think if any silver lining comes out of this pandemic, it's that appreciation of your health. It is quite an important thing, and you need to prioritize it. How do you do that? I think you seek out people like yourself that can help in that way.